Hello, my name is Ashley Simpkins, and today I'm going to be demonstrating how to obtain a wound culture using our DPSB guidelines, our 11 rights, and our 3 checks. We're going to knock on that patient's door, get our 2 patient identifiers, and check that band to make sure it matches. We're going to assess the patient for allergies. We already assessed that patient for pain earlier. We administered her pain meds per order. We've come back. She says her pain is a 2 out of 10. So we're okay to go ahead and start to gather this wound culture. First thing we're going to do is hand hygiene. We're going to don our gloves. And we're going to begin the process of removing this bandage using the push-pull method. If needed, we could use sterile saline to help loosen up these edges. And once those are all loose, we're going to pinch from the center of that bandage and remove. We're going to assess the drainage or discharge on the bandage, and we're going to note using the taco method, making sure to note the type, the amount, the color, and the odor. After we do that, we're going to go ahead and dispose of that bandage. We're going to assess the wound, making sure that we assess the size, the appearance for drainage, and assess the pain around the wound site with the patient. Now we're going to do hand hygiene again, and we're going to clean the wound. We've already checked all of our packaging. Everything is up to date, dry, and unopened. We're going to go ahead and get our sponges. We're going to open this up. We're going to get our non-preservative, preservative-free saline, and we're going to insert that into our gauze and toss that. From here, we're going to go ahead and get 1 gauze at a time and clean from top to bottom, making sure that we get a new piece of gauze each time, and making sure not to go over top of the wound. Now we're going to open another package of our sponges. And from here, we're going to pat dry using the same technique, going from top to bottom and disposing of each wipe in between. And 1 down the center. We're going to remove these gloves, perform hand hygiene, and don on our last pair of gloves. We're going to get our culture swab and go ahead and get that open. Making sure not to contaminate the swab. We're going to go ahead and open that up. And we're going to go from top to bottom in that wound, making a circular motion with that swab. Making sure not to touch any of the intact areas or sides of that wound. We're going to put it back into our collection tube. We're going to doff these gloves, perform hand hygiene, and then we're going to label our specimen. We're going to put the time, date, and the initials on it, and we're going to go ahead and send this off to the lab. We're going to document everything per hospital policy, and I think that's it.